Evening, everybody. Thank you for hopping on this Tuesday. My Story Matters. We've got Dr. Kat Kadin with us. I am Kim Kabensky. I'm an executive with LifeVantage, coming up on 9 years, and it actually looks like Dr. Kat is now surpassed 9 years, looking at 9.5 years with LifeVantage. For those of you who don't know, Dr. Kat is a pediatric and prenatal chiropractor. She's board certified and in functional medicine from the IFM and also has been practicing for 25 years. She's been with LifeVantage since mid 2015. Um, and she also is married with two beautiful boys, 11 and a half and 14. I have been able to meet her husband, Thad, as well. Um, Very beautiful couple, and I'm excited to have her on tonight because she is an expert in brain health, kids' health. And I'm going to let her kind of talk to you a bit about her journey and why she actually chose to partner with LifeVantage and what excites her. But also, I think, we've been so focused on other topics for a while now. Main one being GLP-1 recently. And I wanted to kind of switch things up tonight and focus a little bit on children and brain health. And I know just in the 9 years that I've been with LifeVantage, almost 9 years, the amount of stories that I have, the amount of transformations I've been able to actually personally witness myself has been astounding. And so I'm just really excited to have her here. She's a very dear friend. And yeah, I would love for you to kind of explain a little bit more in depth about what you do and then also talk a little bit about your story in LifeVantage and why you chose to um to partner with LifeVantage.
Thanks, Kim. It's an honor to be here. Thank you for inviting me to join in. So, firstly, LifeVantage and my journey. I I wasn't looking for anything, that's for sure. And I didn't know what I didn't know about what I needed. And when I was introduced to this information in early 2015, I actually was pretty resistant. I had a certain amount of edge to like my demeanor in the sense that I felt like, if it were so great, why hadn't I heard about it, right? And I was humbled pretty quickly because the person who shared with me was also a pediatric provider, and they shared with me that I really had at least, very least, an onus on me to know about this new category of activation, which at the time we spoke about in terms of nutrigenomics, how nutrition affects genes, and how we can biohack our cellular health. And that caught my attention. And so, long story short, through information, persistence, and then just this desire to actually fulfill my Hippocratic oath, which isn't just not doing any harm, but also doing the absolute most I can to take care of my patients. I decided to kind of explore a little bit more. And I went to a gathering, which, there was still a whole lot more in person than there is nowadays, but I know that's coming back. But anyway, pre-pandemic world, was at a gathering and just thought, why not? Let me at least have access to this for my patients. If not for me, I didn't feel like I needed it. And boy, was I wrong on that as well. And so fast forward, I partnered with the company in August of 2015, and I had patients start to get massive changes. One of the reasons why this caught my attention and was more significant than any other product I had ever used, um, was because of the degree of improvement I saw with my patients. And I'll give you an example. I started practicing before there were really like smartphones and Wi-Fi, EMFs, and quite the level of bombardment that we have today. And I truly feel like when I first started practicing, people got better. They just got better, and then we hit a slump where people just weren't getting better. And this kind of reversed the clock. And my patients started to hold their alignments, started to feel better, do more, not have to come in as frequently. And that might seem silly from a business perspective as a chiropractor, but there you have it. So I then thought, hey, you know what? I had a skin condition that was unbeknownst to me, related to oxidative stress. And, you do the math or the oxidative stress math. And when you have something that is clinically proven to reduce oxidative stress, that free radical damage we'd get just from breathing air by 40% in 30 days, I thought, okay, why not me? And lo and behold, it took about a month, and something I had been dealing with for like a year and a half, started to get better as my oxidative stress lowered. So it was remarkable, and the rest is kind of history. I hope that helps.
No, that's amazing. I know that you've had quite a bit of a transformation yourself with our products. And I don't know if you want to talk a little bit about that too. I know that you know, you've I've obviously seen your GLP-1 transformation, but I know that you've struggled as well in the past with certain things, and so maybe you want to share some of that as
Yeah,
well.
sure. Sure. So one thing was definitely my skin. I have some autoimmune health conditions, and I had definitely gotten my thyroid and autoimmune diabetes kind of at a level of control. But I still had some, despite being, gluten free and dairy free and egg free and soy free and all those things, and I'm still gluten free to this day and mostly egg free. I was at a point where I could only get so well. And so from a personal product experience, I can tell you the products that I use now, and I did use them in the order that they came out. But the Protandim NRF2 activator obviously was kind of a game changer. Oxidative stress is just linked to everything, and I experienced less symptoms of Lyme and mold. I experienced less of the restrictions in my function, and the appearance of, like really like not looking good on my skin. Added NRF1, which for the mitochondria, that was a big game changer for one of my sons, actually. And I do use this with kids a lot in my practice, with the NRF2 in tandem, but the NRF1 being for the mitochondria, the powerhouse of our cells. That really kind of showed up a little bit in my ability to regulate blood sugar. So that was remarkable. Axio, our brain health drink, neurotropic. This is one of my favorite products to use with kids, and also just any human with a brain, because many of us have challenges with executive function, and anxiety and mood and ability to have like focus and attention, and in the ingredients in there and the way they're synergistically combined, really does flip a switch on your brain. And I'm blown away by what Axio does, for me on a daily basis. And for patients, when I use it, I see really massive changes. And then collagen activator. That's something that I was surprised that I ended up liking. I was actually, oh my goodness, no, not another company putting out a collagen. And but lo and behold, activation is so different, right? We're turning on our body's ability to make its own collagen, 100% increase in fibroblasts. We have, a patent, we have studies, we have, I mean, even if that doesn't satisfy you, it is remarkable what it has done. And I have used it in little kids, big kids, my own kids as well. In fact, I know someone on here who gives it to her 3-year old, and there's been changes with her, and she's my patient with like speech and just muscle tone. It's you know our bodies are bombarded constantly, and what I see with kids nowadays is that kids are honestly experiencing the cellular dysfunction of grown-ups back in the day. So like kids are born like not as well as they could be. And so that's why I feel like, this conversation, even though our products, haven't been tested on children, that wouldn't be necessarily like ethical. But we're not talking about anything black box warning or anything like some of the things that are prescribed to children. I, dose appropriately, this isn't a hard and fast rule, but in general, for the Protandim NRF2, I would give maybe like a quarter pill per 25 pounds of child. And once they can swallow, it's just easier to let them swallow it. So my kids have been having a whole one since they are like 4 and 6, even though they were nowhere near 100 pounds at that point. And then one NRF1. My 11-year-old still just takes one. My almost 14-year-old takes two. That takes the full dose. What else? I love our omegas. NAD and I go back and forth. I think that's just, I just was too amped up. I feel great. I don't have any of the symptoms of the conditions that I have been diagnosed with. How about that? So I am experiencing like just a much better like life, and I use our skincare, and I have used that skincare on my kids. There's nothing that I haven't used on my kids aside from the NAD. I don't know that they really need that, and my children don't really need the GLP-1. I have used the GLP-1 activator in some patients because I can, right? Like I can recommend that to some patients who are 15 and 16 with some good success. I've and with some of my new moms who, I mean, not like the first 4 or 5 weeks, but pretty quickly they're able to do that, and they have told me that their experience is that they have maintained their breast milk supply. I can't tell you to take something, whatever, during breastfeeding, but I just wouldn't take that necessarily pregnant. Don't take the GLP-1 while you're pregnant. Other than that, those are my experience with the products. I love the daily wellness. I'll use that on occasion. I don't use it daily, just being full disclosure. We have a set number of products, but they're all really fantastic. And so I don't know if that's what you were looking for with explaining, the products and their benefits, but I literally do not have to take anything else, except I take like a magnesium supplement and a choline supplement because I don't eat eggs. Other than that, I literally was able to take my 30 or 40 supplements and just whittle it down to the activators. And I run circles, or I mean, I turned 50 last in December, and I literally run circles around my friends in their 30s. And I literally am blown away by the fact that it's like there, it's activation. It's activation. And I pinch myself sometimes, but I even have colleagues who are chiropractors who don't necessarily function at the level that I do. And for somebody who has the diagnoses that I have in my past, it has to be activation. I mean, yes, I get adjusted, but so do they. I'm gluten free, but so are they. I'm activated, they're not. So you do the math. I'm going to call it activation math. So Yeah.
Yes, no, that's great. I was curious as to what are some of the things that you do see with your patients when you do put them on the activation products,
Sure. Sure. I can tell you.
specifically.
Yeah. So, as compliantly as possible, I'll share this. Uh, Very big topic in especially the brain health world and the functional medicine world to talk about oxidative stress and mitochondrial function. Everything has boils down to inflammation, oxidative stress, and your energy from your mitochondria. Um, and our kids are no exception. So, behavior is a window into a child's brain, and that can be because they are not efficiently detoxifying, um, because they don't have the energy to detoxify, or they have really depleted levels of antioxidants like glutathione, or maybe a prolonged mold exposure has messed up their collagen protein, amongst other things, and oxidative stress levels that are insanely high. So I work a lot with like mold, Lyme, pandas, and pans, and they're all very similar. Everything boils down to neuroinflammation. So even TBIs, anything of that nature, it is hands down my initial recommendation, amongst other things, for them to use NRF1, NRF2, not necessarily in that order, right? NRF2 first, NRF1, and collagen. Collagen works with that MMP9 protein, which is very dysregulated in people who have had a mold exposure. So I'll recommend a course of collagen, for that, because that's one of the genes that is affected positively by our collagen, and that's really cool to be able to stand behind something. When we reduce oxidative stress and activate the NRF2 pathway and can turn on the production of our body's own antioxidants, our God-given antioxidants, like specifically glutathione. If anybody has heard of fatty liver disease from acetaminophen, or even alcohol, or even non-alcoholic fatty liver disease, all of our detoxification happens in our liver, and people's livers aren't functioning these days. And one of the phases, phase two enzymes, is what's improved by protandim NRF2. And that is, documented. It's on PubMed, and it is so powerful to be in a position to take something that upregulates your body's own endogenous, that's inner production of these things. So, do I sometimes use exogenous products to as right now strategies? For sure, but it is an absolute must in general, if people want to get well and stay well, to be activating their body's own production, because we are bombarded. Um, so I depending on the child, like if I have a kid with like low energy, um, and maybe they need something demonstrable and they'll be compliant with it, they might get recommended some Axio. We have a kid who has maybe some is on the spectrum, or PANS. They might be a Nerf 2 and collagen candidate. Um, I might I just, I using my kind of detective skills, I find out what's going on in there, but almost always we have a depletion in some sort of like optimal function of the body. A lot of kids who are like even toe walkers, or very tongue tied, or aren't crawling properly, or not sitting properly, or seem to try to hold up, like teenagers who are trying to hold up a wall with their bodies. My mom's like, my mom, your wall doesn't need support. You know, that's poor mitochondrial tone. My kids have taken the omegas since they're little, the icy bright. Um, so they're really, oh geez, sorry about that. There are really quite a few different things that we can do for for different categories, but I feel like hands down, there's no question that everybody probably would benefit from reducing their oxidative stress. And if you can swing it, you know, activating your collagen production, I feel like the glow stack is an absolute game changer. And if somebody told me I could only have like three products, it would be Nerf 2 collagen and Axio. And then I'd slowly add, NRF1 and GLP-1 and so forth. My own personal journey with GLP-1, real quick, I was surprised to to say the least that like I had some initial changes and then I kind of plateaued for a while. And then I had some really significant changes at 14 weeks. Um, like I dropped like another 6 pounds between 14 and 16 weeks after staying kind of the same. And it just what it tells me is how bio individual we all are, how much we are all very much going to have individual responses to lowering our oxidative stress, activating our mitochondria, activating our NAD, activating our collagen, activating our GLP-1, and turning on the NRF2 in our brain. It's going to look different for all of us, but it's to me a kind of a no-brainer.
I couldn't agree more. But I am also living
Proof.
proof of these products as well. One last question, and then I will stop the recording and open up for questions. I mean, I know the world of functional medicine as well, and I just very much do a lot of research on my own. And do you find that more and more people are becoming more open-minded towards listening, especially like the colleagues that you're around and opening the topic of oxidative stress and mitochondrial health and the GLP-1. Um, do you find a lot of resistance or are you starting to see more and more people
People
opening
are
their minds?
partnering up in droves. Um, I literally, I almost feel like I have to offend people. I mean, it's like such a hot topic now. I think activation is still kind of misunderstood. Um, and that might take some time, but I think the topics of GLP-1 and mitochondria and oxidative stress are definitely hitting more of a tipping point. And especially in the medical community, one of the things that really interests me about functional medicine is we're not all the same. A lot of people are getting excited because now there's an increased availability of functional medicine, but much of functional medicine is sadly just piles of supplements for thousands of dollars a month. And while that is maybe inherently healthier than taking a bunch of medicines, it's no different. It's no different. Um, and getting to the root cause or causes and addressing those is what I do in my practice. Now, these products aren't going to cure, treat, mitigate, heal necessarily anything, but at the root of every condition, every condition is a metabolic health issue that involves inflammation, oxidative stress, and mitochondrial dysfunction. One of my favorite authors on this topic is Dr. Casey Means, who wrote a book called Good Energy last year, and probably some of you have read it. Um, Literally, our bodies are just dysregulated from stress, and if we can mitigate instead of piling on 9 million supplements that take so much energy for our bodies to process and instead just flip switches in our body instead of adding to our body. How cool is that? Like that's what's just like pinch me. This is wild. I mean, it doesn't mean that like if I need a treatment for a virus, um that's going to get done by taking NRF2. But I can tell you that my body's ability to clear these things is much better than if I weren't activated. So that's It's my story. I'm sticking to it.
Oh, that's good. Well, I really appreciate you hopping on tonight and going over a lot of this with us. It's always refreshing to know, that we're starting to get out there more and more. And I think it's just a matter of time. And obviously, we've been in this for the long haul and will continue to be. And it's our job to really continue to be loud about LifeVantage. And
Yeah.
I know it's completely given me my life back, and it's something that I never take for granted. So, um, at any rate, I am gonna stop the video and the recording, and then we'll go ahead and open up for questions. But I do really, really appreciate you coming on this evening. I know that there's a couple questions in the chat as well. So go ahead and
There.